Throughout October, Breast Cancer Awareness Month, we see this sea of pink and ribbons, and we want people to think about breast cancer and we want to raise awareness and we want to make sure people understand the importance of mammography and also that not all mammograms are the same. So, Dr. Courtney Garlick, a board certified radiologist at Mercy Health Comprehensive Breast Center, I recently was overdue for my mammogram. And when I went to the doctor, she said, "You need to get yours. And this time I want you to get tomosynthesis." What's the difference?
So tomosynthesis, what we have is another word we use for it is 3D mammography. And the difference between the standard 2D mammography and the 3D mammography is that the 3D mammography actually lets us see through the breast tissue even better because we can actually slice through the breast using low dose technique. So what we do is instead of it taking one picture like we do with the standard 2D mammogram, it takes a series of low dose images and then the computer recreates those images into a stack that we can actually slice through, like I said. So instead of, it's the best example I've ever heard is instead of having to try to read a book through its cover with all the pages on top of each other and all the words kind of blending into each other, you can actually turn the book page by page.
When you were looking at just the 2D and now you're looking at the 3D, how incredible is that for you? And how much earlier are you able to detect something because of that?
So the 3D mammography has been a great tool for us as breast imagers. So what it does, it not only increases our cancer detection rate, so it allows us to find the invasive cancers when they're smaller and earlier and more treatable, but it also allows us to then decrease the amount of times we're calling women back from their screening mammograms because we are able to see through those tissue and see when it's just overlapping tissue rather than a possible true mass. So on both of those fronts, it's just been an excellent tool, and it's relatively new, but now we've had it for a few years here at Mercy, and I really encourage all women to at least consider it.
How often should a woman be getting a mammogram and at what age should we begin?
So that's a great question because I think there's a lot of confusion out there right now in the media and in, especially with social media and just kind of the public world. So all breast imagers will pretty uniformly tell you that we still strongly recommend that screening starts at age 40 for an average risk woman and continues yearly from that point on. If you're high risk, that's another avenue to consider, but that's something that can be discussed with your doctor. But at minimum, 40 and yearly is my recommendation. And the Breast Care Advisory Committee, which is made up of breast imagers, breast surgeons, our oncologists, and our radiation oncologists here at Mercy all agree with that as well.
So I had my tomosynthesis, and you can actually watch the video if you want.
Go ahead now.
People don't realize when they hear 3D mammogram or tomosynthesis, they think it's going to take longer or be more difficult. It's the exact same thing.
It is, it is. So the amount of time you're actually in compression and your appointment time altogether is actually the exact same for the tomosynthesis imaging. It's actually the same exact machine. It's just kind of a flip of a switch for us, whether we do those 3D images or we just do the standard 2D images.
I like when scientists and doctors call it compression. It's just the squish.
Yeah, it is.
What is it that you want women to know about early detection, mammograms, tomosynthesis? That's the number one thing you want people to know?
Early detection is key. So obviously treatment advancements have come a long way in the recent past, but early detection is still the key to catching these early and treating them early before they become metastatic or spread, beyond our control. So that being said, remember that 1 in 8 women will get breast cancer in their lives. That's a fact. That's a number. 75% of those women will not have any family history. So that's why I still recommend 40 and yearly, because if you allow only for screening at that age for patients that have family history, you're going to miss 75% of those women. So I just don't like those numbers, and we all know someone with or who has had it or some close, friend. And, let's just continue saving lives by doing what we can to first prevent, but to, catch it early.
Sometimes insurance doesn't cover the 3D. Is it worth the extra $50 or $100 somebody might have to pay?
I do think it is. So there is what we call breast density, and without getting too far into it, but it's basically just how white your breast tissue looks on mammogram. The denser you are, the more beneficial that tomosynthesis is. So I do encourage it. I do understand that sometimes it can be cost prohibitive for some women, but understanding that Actually, most insurances are on board now. There's only a few left, I think, that aren't, and that routine area is universally covered by Medicare and Medicaid.
What do you think about Breast Cancer Awareness Month or awareness months in general?
Oh, good question. I think anything that brings awareness to an issue that is so prevalent, especially like I said, 1 in 8 women get breast cancer. So I think anything that brings awareness to it is great. I think what it helps do is helps create funds to help women get their care that they need, do the research we need to help treat this more. And honestly, it's a good time for just, women to go to their friends and say, oh, I saw that breast cancer awareness month is this month, just to encourage your friends and family to do their part in getting them screened. So like I said, catch it early and catch it while it's treatable.
I ask you that because I don't want people to just be aware while they're listening to us talk.
Right.
I want people to think about breast cancer all year long, and hopefully maybe even have a bosom buddy who they say, hey, did you get your mammogram? I got mine.
Yeah, that's very important. And trust me, I'm going to be talking to all my relatives. I do every year.
Dr. Courtney Garlick, thank you. Thank you for talking to me from Mercy Health Comprehensive Breast Center. Thank you. I hope I get to talk to you again soon.
You're very welcome.
See ya.